Hi, my name is Bertrand Dirk, and today we'll be discussing about what abdominal migraine is. So, have you been diagnosed or may think you suffer from abdominal migraines? Well, today we'll be going into greater detail so that you have a clear understanding of what abdominal migraine is, as well as understanding the possible cause and the potential treatment options to help manage and treat abdominal migraines. So firstly, what is abdominal migraine? Now, abdominal migraine usually involves the onset of abdominal pain that is located in the middle of the abdomen, around the umbilicus. Now, these pains are often moderate to severe in intensity and is often described as a dull ache. It isn't uncommon for sufferers of abdominal migraine to also experience nausea, vomiting, loss of appetite, and even paleness during attacks. Now, episodes of abdominal migraine typically last for 1 to 72 hours, with full resolution in between attacks. Sufferers may also experience up to 4 attacks per week. And while it is possible for abdominal migraines to be experienced by adults, they are far more common in children, with the mean and average age between 3 to 10 years of age. Also, children who experience abdominal migraines have been linked to experiencing classic migraines in adulthood. So, while abdominal migraines are classed as a migraine, they very rarely will involve a headache. This may be because episodes that involve headaches are frequently diagnosed as a common migraine. Along with cyclical vomiting syndrome, abdominal migraines are described as recurrent gastrointestinal disturbances. So then, what is the difference between abdominal migraine and cyclical vomiting syndrome? Now, though there are similarities between the two symptoms, abdominal migraine and cyclical vomiting syndrome have different diagnoses and have some key differences. So, cyclical vomiting syndrome can last up to 10 days and typically refers to waves of intense nausea and vomiting, whereas abdominal migraines will typically last for 3 days. Now, while you experience nausea and vomiting with abdominal migraine, it is more typically just experienced as abdominal pain. Pale skin and loss of appetite are also common between both conditions. So, what then is the cause of abdominal migraine? While there are many theories as to the cause of abdominal migraine, none have been definitely proven. It has been suggested that gut motility, gut permeability, and gut function could be altered in all sufferers. This may be due to the role of chemicals such as histamine and serotonin in the body. Likely though, the central nervous system is not effectively performing its role of down-regulating gut activity during attacks. This could be because of the sensitivity of central structures and the effect of certain lifestyle factors like stress or anxiety on the function of these structures. Now, when establishing the cause of abdominal migraine, it is important to differentiate them from other conditions with similar symptoms. An assessment should be aimed to differentiate between abdominal migraine and conditions like irritable bowel syndrome, appendicitis, stomach flu, and gastroenteritis. It isn't uncommon for sufferers of abdominal migraine to have no signs of dysfunction or underlying pathology can be detected on testing. In these cases, modern research suggests that the underlying cause may actually be a dysfunction up high in the cervical spine, which is the neck, and a sensitized brainstem. The brainstem receives input from nerves traveling from all over the body and reacts or passes on this information to the brain. Now, when the brainstem is sensitive, it will perceive non-threatening information such as eating different foods as a threat, which then triggers a pain response where that information came from, for example, in the stomach or abdomen. In the patients that we see, it is common that dysfunction in the cervical spine can actually cause the brainstem to become sensitive, which then results in abdominal migraines. So then, what can we do about it? What are the treatment options? What can you do to help your abdominal migraines? So firstly, it isn't uncommon for our patients who experience abdominal migraines to have tried a wide range of treatments or medications in attempts to treat the condition. Some have gone through over-the-counter pain medications, triptan medications, and even antidepressants. Major changes to diets are also not uncommon. Sometimes these measures can have some effect, but commonly it is short-lived, or sometimes it does not even work. This is where seeking help with a headache consultant comes in play. And also ensuring that you see a professional headache consultant who is up to date with the most modern research to assess the upper cervical spine and the brainstem to determine if they are the true cause of abdominal migraines. So, if you do suffer from abdominal migraines, my question to you is have you actually had your neck and the brainstem thoroughly assessed by a headache consultant? If you haven't, then I would strongly urge you to seek a headache consultant to assess not only the neck but also the brainstem to see whether or not that is the actual cause of your abdominal migraines. So, if that is the case, and if you have been proven to showcase that the brainstem is a cause of abdominal migraines, then treatment can begin immediately. And treatment is actually very successful at treating abdominal migraines if it is proven that your neck and the brainstem is the cause of your condition. So, hopefully you have had a better understanding of what abdominal migraine is, the symptoms, and now the potential treatment to help resolve abdominal migraines. My name is Bertrand, and I look forward to seeing you in the next session. Thank you.